And we are live. Welcome, everyone, to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative podcast. In healthcare, there's often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. So we just started a new series on faith and medicine. This is my mother, Reverend Leona Madison. We had her on throughout all of October in honor of Breast Cancer Awareness Month. She shared her story through a multi-series special. And in the final segment of her series, we started this series, Faith and Medicine. So in the last one with her, we talked about her particular journey with faith and medicine, and now we're going to move into a series of questions that I'm going to have different guests come on and answer in their own way. And this is what I like to call the tough questions. So, faith and medicine, the tough questions. And the reason we're even going into this topic is because in healthcare, there's a lot of research and a lot of data that points to the role that faith plays in people's lives, whether it's faith, whether you call it religion or spirituality, meditation, whatever you call it. There's evidence that when people have that in their life, it makes a difference in the way they receive information, how they cope through the disease, illness, and grief, and their overall outcome, their perspective on their outcome. And in our training as nurses and doctors, we have dedicated training both during our initial training and in our continuing education on what we call cultural competency. So that's understanding people's cultures, their traditions based on their faith and their religion. And when it comes to the Black and Brown community, historically and traditionally, faith has played a huge role. The church has played a huge role in whether people even seek healthcare, how they interpret that care that they're receiving, and their overall understanding of what's really going on and who they allow to be in their support system. The church is definitely a support system. It's a community, and we have nurses in the church, right? There's the nurse ministry, the health ministry, and we know there are tons of people in healthcare who practice different religions, who have different walks with faith. And so it's two topics, two industries that have a very close relationship, but don't often get the attention like we're going to be giving it moving forward. And so today I really want to talk about those tough questions. And let's just get into it. So first, this is our little disclaimer. This show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention from your healthcare provider. If you're having a physical emergency, you can call 911. And if you're having a mental health emergency, you can call 988. If you don't have a healthcare provider and you don't know how to find one, we actually did a whole episode this season. It was our first season episode. It was season 2, episode 1, where we talked about primary care and how to find a healthcare provider. But you're also welcome to send us an email. Let us know what it is you're looking for, and we can direct you to those directories or those resources so you can find someone who can meet your needs. So welcome back, Mommy.
Good morning. Thank you for having me again.
And this is part of our, I believe I'm going to put this out during Christmas. So Merry Christmas, everyone.
Merry Christmas.
We hope you're having a wonderful time with whoever you choose to spend it with. I'm just going to leave it at that. Okay, so let's just jump right into these questions. I'm really excited to kind of get into them. I think I'm going to use these questions every time we have a guest on to talk about faith and medicine to get a different perspective. But we'll see. I'll get your opinion after that. And certainly you all can give us your feedback. And if you have some tough questions you want to incorporate, we'd love to hear those. So the first one right off the top, and this we're asking you to give us your perspective as both someone in the ministry as well as a scholar. Right. And we talked in her last episode that she is an ordained minister who's also received chaplaincy training. And she went to Howard University. Do you want to tell them? Have you ever shared them your education as far as that goes?
No.
Oh, why don't we just do that real quick?
Okay, where I attended.
Yeah, you can start from
The
Mount
big-
Everest. Do you want to do that?
What's my
Not Mount Everest. What's that one? It was Evers, the one in New York.
Montgomery?
No, it was you were going to like a black college and then
Oh, Mega Evans.
Mega Evans.
Mega
that's what it is.
Evans. Okay, then. So I started my undergraduate education at Mega Evans College, which was new at that time. It wasn't even 5 years old. And my major, surprisingly, was nursing. But after I learned that I had to deal with needles and blood, and your grandmother said, definitely you don't need to be nobody's nurse. And so I went into the field of education. And at that time, I think I did a year, and my transcript didn't look so good. It looked like I had a lot of partying going on. So before I knew it, I ended up at Northeastern University in Boston.
Well, you didn't just end up there.
What do you mean?
Lena.
Oh, yes, my grandmother. Yes, my grandmother looked at my transcript and she said, "How is it? How did you do this term?" I said, "Oh, I did great." She said, "Oh, really?" She said, "Well, that's not what the dean said." And the next thing I know, I had 2 duffel bags and I was on a Greyhound bus at midnight en route to Northeastern University to spend the night, my first couple of nights in a YMCA.
Mm.
I graduated with a Bachelor of Science degree in criminology with a goal to be a warden one day.
I thought you want to be a lawyer.
Well, to be a lawyer and also, right, to be a lawyer and also to work in a correctional facility. And after that 4 years was over, then I transferring around with the military and stuff. I wanted to go to law school. That's how that worked. And when I came up into this area, I called Howard University because I had learned about Howard University at the age of 12 as we were on our way to Washington, D.C. for the March on Washington in 1963. And my grandmother told me about the great city of D.C., Howard's Black administration, and about the history of Howard University. So I said, oh, well, one day I'm going to go there. I'm going to go to law school. However, God had other plans, and I ended up graduating with a Master's of Divinity from Howard.
But that's decades later.
That's decades later.
Yes. Yeah. What about all like the Washington School and?
I did a couple of classes, several classes at the Washington Bible School, Washington Saturday Bible School, the Fredericksburg Bible Institution, and then Mount Calvary Bible School. And took a lot of classes with the one and only, the famous Susie G. Owens. And then after that, that's when I started at Howard University. Because I believed all that was preparing me for something greater. And I needed a deeper level of education that I was learning at the Bible institutions.
And what was the degree at Howard?
Masters of Divinity.
Okay. How long was that?
Well, I went part-time, full-time. And so it took me about 4 years.
And that intersected with your breast cancer journey.
That intersected in 2012 with my breast cancer journey as I was getting ready to graduate that last year. And so I was determined that I was going to complete, even though I had people telling me, well, you shouldn't, this might be too much. Maybe, you should not try to finish. And I was determined there's no way. And I told the oncologist, I said, do whatever you have to do, but I need to be in class in August when the semester started. And so that actually happened. And I graduated May of 2013. And at that point, that's when I received about my second year, I received a calling to chaplaincy. I didn't have a clue as to what that was. And my field education teacher just said one day, we have some places for internship in Virginia. And if you're interested in it, because we want to set you where you believe you have been called to make sure that that's where you believe God is calling you to. And so when I went to have a meeting with him, I had shared with him, he was the only person I had shared with at that point, that I was called to chaplaincy. And so he said, "Oh, really?" He said, "Well, great." He said, "Well, we have some locations in Virginia," because he was just paying attention to the VA. But he realized it wasn't Virginia, it was the Veterans Administration where they had some openings for interns. And so I wanted to only do 6 months there and try something else. But the supervisor at that time said, "No, I think that you should stay here for a year so you can get all the training that you need." And that's when he also introduced me to clinical pastoral education.
Okay. And so, just like clinicians, you had to do kind of like clinical hours, right? That's what you're referring to.
Yes,
Yeah.
yes. We had to do 6 months to a year, 12 months. You had to do 12-month internship. And so that's what I did at the Veterans Administration in Washington, D.C.,
Okay.
counseling to the veterans and doing Bible study with them and worship service.
And that was through chaplaincy. And then when did you do this last one?
The residency?
Was that with Robert?
Yes.
Oh, okay.
Yes. I ended that in 2019. I graduated with 14 months in the residency program in a psychiatric facility. And so it just seemed like no matter where I went, I was always placed in the psychiatric facility, And so I said, "Okay, God, I hear you." And so that was very intense.
And so this part of the training wasn't like called CPU or something?
CPE, clinical pastoral education.
Oh, okay.
Mm-hmm.
That's the same.
Mm-hmm.
Okay, great.
Yeah.
Okay, great. So you have a lot of education.
Yes, I would. Professional educator, like your father said. Yes.
So let's get into these tough questions. If
Okay.
if you can't answer them, who can?
I'm
right?
sure you can.
So a very common question people want to know: why does God let bad things happen to good people?
Well, first of all, we live in a world that's filled with pain and suffering. And according to the Bible, Jesus said that no one is good except for God. So all of us have sinned and we are tainted. So there's no such thing as a good person. But I think that people believe that just because I don't drink, I don't party, I go to church, I pay my tithes, I do everything I'm supposed to do, that I'm a good person. But that has nothing to do with why things have happened to you. In life, things just happen. And as one of my favorite authors, Tony Evans, quotes in his book, which I just so happen to have right here, that's called Divine Disruption. He states that he had several people, about 6 people in a 2-year span, including his wife, who had passed. And his quote is, "Divine disruption is a divine reset," which means that even though we have these disruptions, these crises in our life, sometimes that's a different journey, that's a different turn, as God's turning around to do something greater in the kingdom. So we have to not think that we're so good, we're polished and nothing could happen. That's just how life goes.
I know for me personally, so for Tony Evans in particular, very popular. If you're watching this, you've probably heard of him. And, obviously his family's center stage, and they were very open and candid about sharing that experience when his wife died, their mother passed away. And I think it's been 4 years, right?
Yeah, 4 years.
Because he just came out to introduce his fiance.
Right. Not too long ago. Yes.
Yeah.
Yes. And his daughters also had breast cancer right after the wife had passed, but he was still maintained his faith. All of them did.
Yeah, they did. Very, very transparent testimony. But yeah, I know for me personally, even when I went through some, what you can call bad things, I realized like the lessons I got from that, I would have never learned those lessons.
Exactly.
Like I wasn't going to wake up and have that understanding.
Exactly. So our bad lessons, our bad things teach us. It's a growing experience, a learning experience. And also that when someone else come to you with those issues, you're an open book, you're better able to handle them. So before I got breast cancer, I was counseling women with breast cancer, but I never knew what the extent of that was until I actually went through my own journey. You see what I'm saying? And so a lot of times our testimonies, Joyce Myers, another one of my favorite evangelists, said that our testimonies, our situations don't have nothing to do with our circumstances. But as God's going to use us, because he has to use someone on the earth to be a witness to others about his comfort, about his love, and about his protection over your life.
Yeah, and I'm glad you said that, bringing people to you, because some of the things I went through that I struggled through, and I personally learned a lot from it and grew a lot from it. But then years later, people came into my life, and I could immediately see that was for them, so I could help them, and it made it. Of course, you always wish you could have learned things quicker and avoided some things, but it's like, you know what? I'm so glad I had that opportunity because now I can help them. And in some cases, you're the only person who could have helped them. And so it was, I can attest to that.
Yeah, it's like you come full circle, full circle to say, oh God, this is what you was trying to do. You preparing me to go through what I have gone through to help someone else who may have felt, I'm just going to turn in the towel. I can't deal with this. I'm going to take it another route. So, spirits connect with spirits. And so if you reach someone that God has put in your path, and they, like yesterday when I was at my gathering, I was just sitting there knitting and someone was sewing. And it just so happens that the lady had breast cancer.
You meet a lot of people.
Yeah, I meet everybody that had, breast men and women now, and so now I'm like, oh, okay. And, our 2 hours, we're just sitting there and talking about one another, what we've gone through with our families and stuff like that. And so then after we finished talking, then here come 2 more people, and one happened to be a man. And he said, oh, well, I have terminal cancer. So he said, but I'm not worried about that. He said, God's got it, well, either way, God's got it, and so, yeah,
that's true. Either way.
Yeah. And I mean, these are strangers. I didn't really know them like that. Yeah, because they're strangers, and they just walked up. We just had a conversation, and they just opened up and shared.
And it's true too. You might live a whole life and never know why you went through something as well. So that's that. And even though you might not realize it, people are always watching.
Yes.
People are always watching you.
Yes.
And so sometimes you'll never know.
Yes, that's right.
How you impacted them.
Yeah, I learned that in corrections with the inmates. So one day I said it to the inmate. I said, I'm watching you. And he said, well, Ms. Madison, you watching me and someone's watching you. There's always someone's watching, and that makes sense.
Okay, so I would like to discuss how you respond to people who've lost hope due to an advanced disease, receiving a poor prognosis, and death of a loved one.
Oh, that's a great question. First, I would let them talk it through. Don't press them about, opening up or just sharing. I listen, because one thing as a chaplain, you learn how to have listening skills. And you ask, instead of trying to, one thing I learned as a minister, we was trained to feel it when we walked in the room or the church, whatever. Your job is to fix that person. But as a chaplain, I've learned that you can't fix anybody. They have to be able to fix themselves. And all you can do is bring them hope, to a level where they will be able to accept what is first going on with their life and not be in denial. And then to be able to share that with you, and hopefully they'll be able to share that with someone else, And so I've walked into many rooms with people with terminal illness, And the wonderful thing about it in my hospice training is I learned that they're perfectly fine. you know, they're ready to go and meet their maker. And do what they have to do and be comfortable. It's the families that it's the families that you more deal with, because they just want them to be here, even though this person is suffering. And my prayers always, Lord, let your will be done, not that, because we always think, well, we want this loved one to be here. We don't care if they're in a vegetarian state or what's
vegetative
state. We want them to be here so that they can be with us, even though they're suffering. And my prayer has never been, let them stay here so that I could be comfortable, all their loved ones. And so you just kind of walk with them through the journey. I've turned music on, read Psalms, and one patient, I walked in her room, I said, "How you doing today?" And she says, "Oh, I'm doing fine. I'm just waiting for the Lord to come." So she had a peace. She had a peace about herself. And so most of the spiritual care counseling is for the families who's in, some of them are in denial, which I'm sure you experienced that even as a nurse. They can't accept it. They move from one doctor to another doctor until they get that doctor that's going to say, "Oh, they're just going to be fine," when we already know that that's not what's going to happen. So the prayer is, let them be comfortable and let them not be suffering. That's always my prayer.
Yeah, actually, yeah, that's a great point, because I have often said that, I think listening is our most important clinical skill. And you can do that whether you're trained or not, right? And it's still true. Actually, I kind of struggled with this as a clinician. You get all this training and all this education, and you get frustrated when people don't follow your recommendation. And you have to come to a certain point. I think all of us who stay in healthcare realize that we can't do more or care more for patients than they are willing to do for themselves.
Exactly.
All I can do is bring the information and the options forward and support them in the decision that they choose to make.
Exactly.
And that even relates to family members, right? Who it's like you feel like you have this education and training to help them, to save their life. And still you cannot do more for someone than they can do for themselves. And so I think listening is a very powerful skill. And it's true, whether it's chaplaincy and healthcare, even in relationships, we can't fix other people.
Right. Exactly.
But sometimes just sitting there without being in a rush does a whole lot for someone who needs to process their thoughts and just get them out there.
Yeah, so we call it ministry of presence, where you're just sitting there in the room with them, and just sometimes they might not say anything, but just your presence there, at least let them know, especially when they're on a hospice stage, that there's someone there with you. And that's why I always looked at hospice as a unique care, because in the beginning, if you think about it, when we're born, our mothers are there. They welcome us into the world. And then at the end, because death is a part of life. And at the end, there should be someone there to see them cross over.
Yeah, at one of the facilities I worked at, there was it was a protocol that no one dies alone. And so when we do get to a point in a disease where we kind of have an idea that that's where we're getting close to, we can always call someone who can sit there. Even on units I've been on, maybe I'm not if I'm the primary nurse, once I've taken care of everyone else, I might go spend time with them. I love to play music for people who are dead, who are dying, people who are really confused or dementia, going through dementia or delirium. Music does a lot. And I don't have to know. Sometimes maybe we just look alike. And I have an idea that maybe they like this kind of music, and I just play it for them. And it has opened up so many conversations. And sometimes people, maybe they're not verbal anymore, but maybe they just raise their hand or nod their head or wiggle their toe, or, you never know, right? And especially if I have taken care of them leading up to that point, maybe it's been a few weeks or months, maybe I know something about them. And so I might pick songs based on that relationship. And I sometimes will ask the family, types of music they like or shows they like to watch and just play that for them. But yeah, oftentimes people want to know, what can I do?
Right,
And
right.
that's what you can do. And so, how you talked about, you have to be comfortable in your own skin, understanding your own biases. Not everyone's comfortable in
Comfortable.
silence.
Definitely, yeah.
A lot of people are not comfortable in silence. And so even if you say go sit with them, just listen, for some people that's very uncomfortable. But it's actually a wonderful thing you can do for someone.
Yeah, definitely. And I would like to take them flowers, because often the facilities would have flowers that came from special places.
And the funeral?
Like the funeral home. And and I would like to get the flowers and put them in a vase and stuff, and put them in their room and stuff, especially for the females. And from funerals, you just
so you do have to, it depends on where they're located, because there are some units where fresh flowers, and some patients where fresh flowers are not permitted. So just ask in advance, but the staff will definitely take it and sit it on the counter.
Oh yeah,
and
definitely.
Enjoy it.
Definitely.
And so we've talked about advocacy plenty of times on this show and through your series, and also in religion, there's the topic of intercession. So I would like to talk to you about the relationship between intercessory prayer, and advocacy.
Okay, well, for advocacy, it both is kind of mingle with one another, because you're standing in the gap with someone, and you're praying or you're speaking on their behalf, because everyone don't like to speak. Some people don't like to speak. Some people don't like for people to be in the know. So, as if an intercessory, I'm going to pray on somebody's behalf. Sometimes people don't tell you what they want you to pray for, and I respect that. It's not like, well, what do you want me to pray for? No, if they just come and say, I want prayer, I want you to be the intercessory, then I just pray. And advocacy is similar, because advocacy is someone need help, and they need, and I have many resources and know many resources, and so I stand in the gap for those individuals. I know a lot of people, a lot of resources, and just do the research to help that person, because a lot of people don't know. We always assume everybody just know everything, and sometimes people don't know things like that. Like with the breast cancer literature, belong to several committees on breast cancer. So for cancer survivors, of course, I share that with them, and accessory, share certain scriptures with them, that they can go back themselves and read, because we want you to be able to read and dissect and understand the Bible as well for yourself.
So, it's not unusual as a clinician taking care of someone, especially, if someone's really sick or going through really acute illness, that the patient might ask the nurse to pray for them, or the family might ask, or they look you in their eyes, they're holding your hands, they're crying, and they're saying, please don't let anything happen to my loved one. Please don't let anything happen. Or they're telling you that they're going through their own diagnosis, or you hear like the person you're taking care of, their partner just died, their house just caught on fire, or you see this person needs help and they don't have insurance and they're going to get discharged tomorrow. And so it's hard to take care of people and not encounter their faith, their religion, their beliefs, and then have to contend with your own, whether you have a practice or not. And so where can clinicians and caregivers start who desire to intercede for patients and loved ones if they've never done it before?
Well, I would say they can ask staff for a chaplain. And then they also have social workers, and they have Christians on staff. People in the medical field, they are Christians, and so that's some resources that they could reach out if they belong to a church. And unfortunately, a lot of times when people get in the hospital for a long time, sometimes they don't hear from their churches, but it don't always have to be, but have you contact the church, because sometimes we assume, well, the pastor should know that I'm in the hospital. But if you haven't picked up the phone and called the church, then they don't know. And then there's also outside resources, community outreach programs and stuff like that you can reach out to, have someone. Usually the social worker in a healthcare facility is a good resources for that.
Yeah, and I think we provided some examples, just listening, playing the music. And so, yeah, then whoever's listening might say, oh, I'm busy. I can't sit in there and hold someone's hand. I wish I could. So, especially because I worked at night, I felt pretty safe. And I would just leave my cell phone in there and play the music for them while I go take care of other patients. And like I said, when I had some downtime and I was going to chart, I would just go sit in there and spend time with them. So those are also some things that you can do if that's something you desire and you've never done it before. And just remember that there's no right way to do it.
And you could also ask the patient, what would you like?
Yeah, that's
would
true.
you like some Psalms? Would you like me to read a book? Or, today, modern technology, turn on the YouTube. You could also ask the patient, and remember that the patient, as long as they're conscious, they have a way of, even if they're not conscious, there's information in their chart that can help you learn how to communicate with them. Because sometimes we overlook that the patient's right there in the room. So just ask, what would you like?
That was a really good point. Yeah. So before we close out, anything else you want to say about those tough questions when it comes to faith and medicine?
Well, I want to say, as a ordained Baptist minister, is to have a relationship with God. That's where it all starts. You have to have a relationship with God when you're seeking faith, understanding, and want to be connected, because the church do stand as your family, as your church family. And during those crises that you're going through, you need someone to stand in the gap with you. And if you're at a local church and it's not fitting or feeding your needs, then there's just so many churches in the world that we're blessed on this side of the world that we can join and get into Bible study, ask questions. And we're a blessed society today that we have churches that actually have health facilities, health ministries, and self-care and mental health, and whatever you need today, even divorce counseling, whatever you need today, there are churches that have those services there. And they're free in the church, free, and they're professionals, they're Christians. And if you just so happen to be someone who's not a believer, know that it's never too late. And just go where the Holy Spirit guides you, or go where you feel that you are going to be fed, and become a part of the community of faith.
Thank you. Yeah, and if you're watching this and you belong to a different denomination or no denomination at all, and you want to come on and answer these tough questions with me, I'd love to have you on. You mentioned the Baptist denomination, Christians. And one thing that's kind of really grown lately, I think, is the non-denominational church. And so we would love to have everyone's welcomed here. And so, yeah, I look forward to continuing this conversation. So today we recap some of those really tough questions that come across when we discuss faith and medicine. And this is really just the beginning of that. We talked about how intercession and advocacy really intersect, and all you're doing is standing in the gap for someone who can't speak for themselves, which is what Lori and her sister Paris talked about when they came on for breast cancer, talking about advocacy and speaking for the voiceless. And that's the same thing we encounter when we're caring for someone, either as a clinician or as a caregiver. Remember, everyone, you can email us your show ideas to tmi.melanin@gmail.com, as well as your questions. Subscribe to our YouTube channel and follow us on Instagram, TikTok, and Facebook. Please share the show with anyone you know. It helps get the message out there to those who really need it. If you rate us on Apple and the Spotify podcast, it really helps us climb up higher on the search when people go looking for these particular topics. You can find our social media links and list of resources that we've brought up today in the description box. We release a new show every week on TMI Tuesdays at 10 a.m. on YouTube and all your favorite podcast apps. Some of these special episodes come out on maybe like TMI Thursday, just so keep out for that. Sometimes we sneak in some special guests and special topics just to keep you engaged. Follow, like, share content with all your friends. And once again, everyone, thank you for watching.
Bye-bye.
Thanks, Mommy.
Thanks, daughter.